Hello, I'm Karen WATCHMAN, Senior Publications Manager with Alzheimer's Disease International. ADI are the umbrella organisation of Alzheimer and dementia associations around the world. And the World Alzheimer Reports, produced on a different topic each year, are a comprehensive source of global information on dementia. The reports are commissioned by ADI from a range of international researchers, universities and authors. And our 2021 report, Journey Through the Diagnosis of Dementia, was ADI commissioned McGill University in Canada. During the World Alzheimer Month campaign in September, we focused on the warning signs of dementia and the importance of a timely diagnosis. And the report includes 113 expert essays written by health and social care professionals and researchers who were invited to submit a short essay in their field of expertise. 3 surveys were conducted, firstly with people living with dementia and carers, and we had 205 responses across 83 countries. We had 101 Alzheimer and dementia associations respond to their survey, and 1,111 multidisciplinary clinicians in 108 countries. And that breaks down to 62% from high-income countries and 38% from low and middle-income countries. We also sought individual case studies from people living with dementia, and we have 11 such testimonies included in the centre, right at the heart of the report. And geographically, our participants here covered all WHO regions. As an example of some of the findings, stigma and lack of information came across really strongly still. This is a recurring theme we've certainly found. As another example, the majority of people with diagnosis felt that they were not given enough information. Yet we know that there is 98% of respondents from the Alzheimer and Dementia Associations stated that they do provide updated diagnosis information and areas for support on their website. So there's a disconnect there. But we also know that there's not enough accuracy in the diagnosis itself in terms of the specific type of dementia. And this is important in terms of progression, treatment, and ongoing support. Certainly, it was also apparent that around 1/3 of clinicians in the survey felt that there was nothing could be done about dementia. So that certainly was an alarming statistic. As you would expect, COVID-19 has complicated an already time-pressured diagnostic pathway, with by far the majority of clinicians identifying delays and additional times. So not only do we have delays in appointments or missed appointments, but also there was an issue with the time spent with clinicians by individuals going through the diagnostic process, as most of that was remote and conducted, for example, using telecare, using Zoom or equivalent, or by telephone. So certainly among the clinicians, there was very much an awareness of the increasing number of people that were going to be seeking a diagnosis in the future. And partly that is connected to the ageing population, which leads us on to a sample of the recommendations from the report. You can see the QR code, which will take you, if you scan it, will take you to the full report, including the full list of recommendations, and the web link is there as well. But certainly what's coming across clear is that governments globally must urgently start to measure and record diagnosis more accurately. Healthcare systems are just not prepared. The governments must also recognise the right to a timely clinical diagnosis and put in place the capacity to deliver this to enable better planning, treatment, care and support. So I would urge you to follow the link or scan the code and have a look at the full report, have a look at the the content there. Our 2022 World Alzheimer Report will focus on post-diagnostic care and support, and this will also be produced by McGill University in Canada. Thank you.